For more than 50 years, the occupations system of care has been 4 rich traditions and 1 shared vision, supporting people and communities so that we all can have happy, healthy lives.
By now you've heard we're one organization with a new name, Access, Supports for Living. But though our name has changed, our mission and our passion to support people on their journey for health and recovery remains steadfast.
Innovation is part of who we are as we serve people who face different and diverse challenges. Here are just a few of the many lives we touch.
The Route 52 group home opened up on September 10th, and to see the transformation was absolutely amazing. When I tell you that I wish I could share the hugs that I got when the kids walked into the house when it was done, I think my ribs are still hurting from that. So it uplifted everyone in the house. You can see such a difference in the boys, in the new atmosphere, a new community. They're excited about life. They're excited about being here. They're excited about the future. They're excited about what we've been able to do with them. At the group home, we take in kids that might not be able to be at home for different reasons. They may be having trouble in the community, and we bring them into our home and we try to give them the supports they need to move on and help better their future. I tell my friends, whatever you envision a group home is, we're not that. We are a home. We are loving, caring, and the boys love and care back. And I encourage people to stop and think about these kids as human beings and not just, troublemakers that have nowhere else to go. They're kids and they need love and they need us.
Marcello was born with a fatty oxidation disorder called LCHAD, and he is missing the enzyme to break down long-chain fats for energy. He was diagnosed at 4 months old, where he had gone into a crisis, and from that point forward we needed additional services to assist with his medical condition. And so that's when we started using family empowerment for our early intervention services.
Marcello lives at home with his mother, father, and brother, and they're a great support for him. He also has a nurse that's been with him since he's 1.5 years. Marcello's doing well at this moment, but he is monitored daily for any changes that he would have.
He does not have the ability to break down the long-chain fats for energy. His body then starts breaking down muscle, which then lends to rhabdomyolysis, which in layman's terms means leg pain and arm pain for him. And so it's really important in those kind of situations where you reduce all activity and increase his sugars to build that muscle back up.
My arms and legs hurt really bad, and it's hard for me to move, and I can't play around. I have to sit on the couch or watch TV or rest.
The pain could be somewhat extreme. It almost says that it hurts to move, and so it's not necessarily a paralysis, but he becomes somewhat immobile just because the pain is too much to bear. So at times it can be very overwhelming having a child with a disability, and it's such a reassurance knowing that you can just pick up the phone and call Amy and just say, look, I'm having a rough time, and for her to easily just say, don't worry about it, I got it, what do you need and what's the number, and I'll take care of it, and a couple of days later, I've got this for you and here's the answer. It's priceless.
We became involved with occupations because my son had attempted suicide while in the state of Florida. While he was in the state hospital, he was diagnosed with schizophrenia. And, that 6-month period, very, very stressful time.
It's kind of frightening when you're posed with something that involves someone you love and they have a problem and it's your family, and you really have no tools on your own to deal with it.
In order to get him out of the state hospital in Florida, we needed to have professional facilities available.
When we first got the call from Becky, the situation was really very critical. She had been encountering a lot of roadblocks, a lot of difficulties with the hospital. They were not comfortable discharging him unless there was a clear plan, a clear plan of action that could certainly meet the needs that he was presenting to them.
I did not know the depth of the services that Occupations offered. Certainly didn't realize what the legal ramifications were transferring someone from one state to another. And they were able to transfer him to us and to under Occupations auspices.
So we were able to very immediately allay those concerns that existed regarding whether or not an adequate treatment plan could be put together on short notice.
And we were able to bring, get Ryan back and more or less bring him back to life. And that's something we couldn't have done on our own.
When your child is diagnosed with a mental illness, you go through a lot of self-evaluation, and you realize how big denial is in your life. It was very, very difficult.
You always say to people, especially your children, we went through this. It's easy to get through this. Well, you know what? I didn't go through schizophrenia. I don't know how to help my child with schizophrenia. Okay, I need people that do know how to help a child with schizophrenia deal with it. Because when as individuals, when you can't do something yourself, there's a high level of frustration. So when you're able to find the solution, it's a big weight is lifted.
I can't imagine what we would have done if we didn't have Occupations to come to. They helped us have our son released and helped us bring our son back home.
I was 20 years old when I came to Occupations because I think I needed more help to be more successful for the things I do. So I decided to come to Occupations because you learn more.
When I met Linda and we had the intake meeting, and at the time I felt that Linda was able to be part of the program, learn the skills that were necessary, and to want to live independently.
I live at Sunrise Gardens apartment that Occupation built. They're very good apartments.
Linda has had many health concerns. We've helped her negotiate doctor's appointments. We've helped her negotiate surgeries. I would consider Linda an actual miracle that she's still with us today.
So I met Brian at Occupations.
I started Occupations in 2009. I started over here at Scotchtown.
We set up dates to go out to movies and stuff like that. And we really came lovable, like two little bears.
We watched their relationship. We helped counsel at times on all the things that we all have to know.
Got married in July 31st, 2011, and it's been 3 years for us. And we both doing a good job.
We planned a wedding. All the staff came together. Everybody made food. It was a great event, and the day was just a perfect day altogether.
The wedding was big, huge.
My wedding day was really good. A day I won't forget. She cooks because I don't know how to. But I clean. This is the first apartment on my own that I've had. So I like it.
And Linda has come very, very far. I'm very proud of her. And she, like I said, she truly is a miracle.
I'm working, I'm married, I got a beautiful life ahead of me.
Well, I entered the mental health system in '64. I needed structure, I guess I can say, and to find a purpose in my life rather than just existing.
PROS is a relatively new model of mental health treatment. It's part of the recovery movement, and the recovery model believes that everyone
who has a mental illness can get better, can have a productive life, and also can either work or volunteer or participate fully in community life.
You see, before PROS, mental recovery was not orientated to recovery, was just to maintain. And that's what I was doing before PROS started. I was working, but that was it. I wasn't active in the community. I didn't feel I was a part of anything.
Whatever your goal is in life is something that we can help with here. A lot of times mental health can seem to pose a barrier or to be a challenge to us getting to our goals, and so it's the therapist's and the staff's job to help talk about it, but it is the client's job to work toward their own goal and reach their own, whatever they feel recovery is to them.
Now I know what my symptoms are. I know what I want to do in life. See, PROS teaches you how to have self-esteem and to have confidence in yourself. Recovery, that's the main emphasis. Recovery from your mental illness.
I can't really overstate the degree to which this is a real revolution in the treatment of people with mental illness. It's really a dramatic change for the better in every way.
You know, I always used to say, a man's reach should exceed his grasp, or what's the heaven for? Well, I've reached my heaven, so now I got another grasp to go to.
Working is really important. It helps folks belong to the community. And so that's why it's a great next step for anyone. No longer having the days where folks have to wait to feel better to work. Work is a part of feeling better. So that's what we need to work on.
Our family business has been working with occupations for a number of years. And it's always been a group that we've admired. And then more recently, we've gotten to work with some of the individuals from occupations in our locations, which brings a whole new dimension to it and makes it a little bit more personal for us.
I'm very grateful, really. I didn't even think I would even have a job with my criminal record, with my explosive history. It just shows you that if I pursue something, if anyone pursues something, and they take the time and work at it, anything's possible, really. I'm just grateful for all the help and trust and belief that everyone had in me. Because if I didn't have that, I wouldn't be here right now, really. I wouldn't be the person that I am today.
Working makes me feel magnificent. Makes me feel positive, makes me feel energetic, makes me feel being more independent, being responsible.
And working with the organizations that help those with disabilities has been a great resource for Benora Hospitality. You get individuals who are excited to come to work.
I think that we can say without any doubt that we have some really dedicated, wonderful people that bring life and energy in to do jobs that we had a hard time filling otherwise. And we're proud to employ them, and they're proud to work here.
It's a breath of fresh air to see someone truly care about their job, show up for work each day happy and ready to work and do a great job.
I'm proud, really, to know from where I was to where I am now. With everything I've gone through with my past, my present, and hopefully my future, I feel a lot better now than I would if I didn't go through all these things this time.
And it's a win-win for us because we're always looking for happy, enthusiastic employees who want to show up day after day, that are consistent, and they're so enthusiastic about their job that it makes the work environment a happy place, and it rubs off on our other employees.
It's a life moment, given this opportunity to work in the community, and I love being who I am. That's me, Kelly Young Simmons. So I feel good. I feel good right now. I feel good today. I feel good every day. Wow. And for the rest of my life.
These are just some of the wonderful stories. People using supports to strive for a healthy life, and our community joining in the dramatic movement from disabilities to possibilities.
We will continue to be a resource the Hudson Valley can rely on, leading what we all want and need: access to health care, to opportunity, and to one another.
We strive with the people we support and all of our partners to achieve rewarding lives and healthy communities. We are Access, Supports for Living.